Hello and welcome to 5 Minute Videos. This is a review for the NCE. Today we are in clinical focus and we are going to be talking about subcategory F, which is cultural adjustments. Now, when you hear the word adjustment, think about a change that has occurred. In this scenario, when I think of cultural adjustments, I think of a change in the environment, because usually with cultures, there is an environment factor. So for many clients, due to such things as globalization, due to financial conditions, security, psychological insecurity. A lot of that causes or is a motivation for moving from one place to another. So it can be within a country. So, for example, moving from Texas to another state, or it can be from one country to another. So moving from Mexico to the United States. So when that happens, then many times that is considered a cultural adjustment because now they are in a different environment, and that different environment includes individuals from different cultures. So the person that makes that transition now has to have that adjustment period. So it could be an example of moving from one country or city, and that can be both exciting, because of the new opportunities or the new jobs or the new, areas to explore, but it can also be very intimidating, right? Having to adjust with your social circle, um, your new schools, your new jobs. It can be a new language. It can be a lot of different issues of adjustment. So, whenever we talk about cultural adjustment, understand how that shifts. So, there is a period of adjustment, and that can vary from a couple weeks to decades. Um, Cultural adjustment is a normal process of adaptation. 4 or 5 generations ago, most people were born within a 26-mile radius of where they ended up passing away. But now, again, because of transportation, technology, and globalization, people are becoming increasingly more mobile, and they're increasingly able to um, migrate depending on their resources and their their push and pull factors. Um, Other things that you should keep in mind is whenever there is a cultural adjustment, you should understand the comfort level. You should understand the dominant versus non-dominant cultures. You should understand the difficulties in the mental health and their concerns, and whether they even wanted to move or not. Many people, even within the family, you may see some people that were excited to move, while others who did not want to move or did not want to have that shift. There's also the issue of homesickness, missing, where you're from. It's almost sometimes they may even romanticize that place because it's something that they have such fond memories of. So whenever we talk about the cultural adjustments, there are phases. There's a honeymoon phase, which is kind of that excitement. The crisis phase, which is that cultural shock, not the overwhelmingness or the feeling like you can't adjust. The recovery phase, which is Now you're becoming more realistic with where you're at, and you're sensing a sense of, where it is that you want to go. And then the adjustment phase, which is now you are adjusting to your new setting. Now you're, making friends. Now you're participating in the new environment. And then some of the symptoms of cultural shock, which is that crisis phase, is changes in sleep habits, eating patterns, loneliness, confusion, doubting yourself or doubting your choices. So that's just an overview of some of the things that you should keep in mind as a clinician whenever a client is having a cultural adjustment.